Next topic we have are warts. Next topic. What are the common warts? Common warts are small, grainy skin growths that occur most often on your fingers or hand. Rough to touch, common warts also often feature a pattern of tiny black dots which are small, clotted blood vessels. Rayan, you have a question?
Yeah,
Uh,
sort of. But I have a question. Yeah, I always see these on some people's hand. But what happened if you cut them? Like, do they come back again in the same spot, or like they leave a mark, or what? What does happen?
It is skin growth. So cutting it is basically just like cutting your own skin, opening up your own skin, and it could be like it could. Um, there could be more infections that happen to your to that spot. So yeah, we're gonna talk
Oh,
more
okay.
about
Thank you.
the
I
complications.
think he means if you cut the skin, affected skin, does it come back as normal skin or the same affected skin?
Yeah.
Same skin or affected skin?
I would say affected skin, but I'm not sure though.
Oh,
I
okay.
mean, when you cut it, you bleed, and if you don't care about it, some infections might occur.
That same virus, if you don't clean it off the place, it's gonna spread again. It's gonna cause the same problem probably. But we could just search that in depth and deep. Uh, common warts are caused by a virus and are transmitted by touch. It can take a wart as long as 6 months to develop after your skin has been exposed to the virus. Common warts are usually harmless and eventually disappear on their own. Symptoms: common warts usually occur on your fingers or hand and may be small, fleshy grain bumps, flesh-colored, white, pink, or tan. They are always rough to touch, sprinkled with black pinpoints, which are small, clotted blood vessels. Next slide. See your doctors for common warts if the growths are painful. Basically, see the doctor if serious matter. Um, what things that you need to look out for specifically is if the growth is painful or changes in appearance or color. If you try treating the warts but they persist, spread, or reoccur, if they spread or become larger, you might need to talk to a doctor. The growths are bothersome and interfere with activities. If they interfere with everyday life, you have to see a doctor. You aren't sure whether the growths are warts. If you're not sure what it is exactly, maybe you need to see a doctor and see if it's not a more serious illness. You are an adult and numerous warts begin to appear, which may indicate the immune system is malfunctioning. So it may be a problem in the immune system, and if you're growing older and more warts appear, it is probably a uh, problem in the immune system. Next slide. So, what causes these warts? They are mainly caused by HPV virus. Um, the virus is quite common, has more than 150 types. So it's no predicting what type you have from the start. But only a few cause warts on your hand. There's only a few that specifically cause a wart. Um, most forms are spread by casual skin contact and through shared objects such as towels and washcloths. Basically, it's like any virus infection. Um, if you touch anything that has it, or like maybe somebody has a wart and he's using a towel, and then he leaves this, and then you use that same towel, maybe you'll get a wart as a uh, consequence. The virus usually spreads through breaks in your skin, such as hangnails or a scrape. Biting your nails also causes warts to spread through your fingertips and around your nails. It's common to see people with a habit of biting their nails. Um, you use your nails to touch everything, so biting your nails after you touch everything is not a good idea, as you may get infections because of it. Um, each person's immune system responds differently to the HPV virus and the many types it has. So, not everyone who comes in contact develops a wart.
People at higher risk of developing common warts include children and young adults because their bodies may not have built up immunity to the virus. People with weakened immune systems, such as those with HIV or AIDS, or people who've had organ transplants. To reduce your risk of common warts, avoid direct contact with warts. This includes your own warts. Don't pick at warts. Picking may spread the virus. Don't use the same emery board, pumice stone, or nail clipper on your warts as you use on your healthy skin and nails. Use a disposable emery board. Don't bite your fingernails. Warts occur more often in skin that has been broken. Nibbling the skin around your fingernails opens the door for the virus. Groom with care and avoid brushing, clipping, or shaving areas that have warts. If you must shave, use an electric razor. In most cases, your doctor can diagnose a common wart with one or more of these techniques: examining the wart, scraping off the top layer of the wart to check the signs of dark pinpoints, dots, clotted blood vessels, which are common with warts, removing a small section of the wart, shave biopsy, and sending it to the laboratory for analysis to rule out other types of skin growth. Most common warts go away without treatment, though it may take a year or two and new ones may develop nearby. Some people choose to have their warts treated by a doctor because home treatment isn't working and the warts are bothersome, swelling, or a cosmetic concern. The goals of treatment are to destroy the warts, stimulate an immune system response to fight the virus, or both. Treatment may take weeks or months. Even with treatment, warts tend to recur or spread. Doctors generally start with the least painful methods, especially when treating young children. Here's the end of the presentation. Thanks for your attention.